Welcome back to the Radian Podcast, your go-to source for digital product-focused discussions on design, technology, and digital health advancements. I'm Maxwell Murray, your host, and I hope today's episode inspires your next big idea. In this episode,
as individuals that are working in digital health, are working in innovation, is part of the job, the role is to help people see the aha moments, right? How do we innovate unless we can generate the aha moment?
Okay, hi. So Deb, again, want to thank you for joining us here. Can you tell us about PainTrace and your role as the president and CEO there?
Sure, I'd be happy to. First of all, I just, being here is really wonderful. So I appreciate that. PainTrace is the ability to quantify acute and chronic pain. And it's done via a wearable. We are able to detect afferent and efferent signaling, so neurosignaling, which is processed by the brain. But we can do it with skin-based sensors. But that's kind of the very, sort of nuts and bolts version of it. Acting as a CEO, president of BioTraceIT, and bringing PainTrace to market's been an interesting ride. I got to be honest, when I think about being able to quantify pain, when I first started this role, I literally was sort of embarrassed. It was like, people ask, what do you do? And I'd be like, oh, we measure pain. And it's like, and I know that sounds crazy. But it got to the place where, it started out with just watching it. I've been in healthcare for a long time. So watching it to see what it does, figuring out and observing, wow, this is really measuring and quantifying pain. But it also, being president and CEO, is about meeting with people and helping them understand what you do, and helping them understand and see what PainTrace is capable of. So when I was first beginning my work with PainTrace and BioTrace at the company, a friend of mine, I worked in orthopedics for about a decade earlier, and the chief of orthopedics at University of Pennsylvania Hospital said, Deb, come on in. I'm going to set up a meeting with a couple of orthopedic surgeons, some anesthesiologists, and I want them to see PainTrace. And I went, okay. So we start chatting and true to form, like, let's not bore everybody. He just picks up the device. He goes, I want to try this out. Puts on a couple sensors and then takes a pencil or pen. I can't remember. It must have been a pen most likely. And he just jams it into his forearm. And it was before we actually could watch everything real time. And it's just a number and nothing's happening. So he turns to the director of the anesthesiology and he goes, here, hands him the pen. He goes, obviously I can't put myself in enough pain. And the anesthesiologist jams the pen into his forearm and all of a sudden the numbers just start dropping. And back to what I was just saying, when you first start saying we quantify pain, you feel a little bit stupid. It's like, not to use that word, but you just feel like, yeah, I'm not crazy, but we do.
Yeah.
And everybody just went, wow, because seeing was believing. And so, when you ask, what is PainTrace? Yes, we quantify acute and chronic pain. And we do that with a wearable. And what is it like being the president and CEO of BioTraceIT? It's one of those wild and crazy rides that come with a lot of funny stories. And quite frankly, there are those moments when you're like, I know this sounds crazy, but we do this. And then just because you know a lot of people for many, many decades and they know who you are, they believe you. And that's what opens the door.
And you said something so important, the things I've seen as you've demonstrated, and we've been at conferences and places together, it's always been so interesting to watch the aha moment across the room. At first you're like, okay, quantify pain, how? And then you show people how it's done and it's like, aha. And so that's one thing that's so impactful here.
Thank you. Yeah, it is the aha moment, right? And I think that, as individuals that are working in digital health, are working in innovation, it is part of the job, the role is to help people see the aha moments, right? How do we innovate unless we can generate the aha moment?
Yeah. Yeah. And, you know, from the perspective of the work we do, that's very much so driven by really thinking about the influence it'll have on the human experience. Like at the end of the day, patients, clinicians, everyone, they're human beings. And uh, maybe not everyone learns the same way I do, but examples are helpful. And so like bringing ideas to fruition that actually apply to my life. And we'll get into that further in the discussion later, but that's what makes innovations and solutions like this so interesting. And humor me, like, do you know kind of like what was the original inspiration for even exploring this technology? Like, how does someone even say like, we should figure out how to to better quantify pain?
I really describe my life as a series of stumbles and dumb luck. And quite frankly, because people have asked, like, how did you get here before? I'm like, it's a series of stumbles. But years ago, I was working with Synthase, which is at the time, it was the largest orthopedic company globally. And I was working on a rather large clinical study. It was 250 sites around the world, and in collaboration with Eli Lilly. And I was reviewing the protocol that had been already passed through the FDA. I was not involved with that part of the program. And I remember reading it and going, why are the outcome measures for this study, in other words, how we're measuring pain, that we're going to have somebody stand up and walk a certain distance and time that? And then why are we asking them to tell us on a scale of 0 to 10 what their pain is? Because I hadn't had pain at that point. I have now. But it didn't really dawn on me that we do now with PainTrace, but the gold standards for pain measurement are self-report, which is a good thing. But there are some subjectivity there, and things like timing, how fast somebody can walk, how fast they can do a particular activity, how far they can bend a joint, flex a joint. And it, I almost actually like contacted the people in charge of the protocol and said, why did you do this? And then I realized, well, maybe I should just look it up. And I found out that was the gold standard. And I went, okay, wow, okay, I am ignorant. Now I am learned. And then literally the other aspect of it is, again, like a series of stumbles and dumb luck. I do believe in random acts of kindness. I do believe in talking to people that you don't know, because that's how you learn more. And in doing so, and engaging in yet another random conversation, I met a person while getting on a train that had some access to some technology that was the beginning of PainTrace. But it wasn't because I was like, so super smart, but more because, I was able to really engage people, be open, be willing to learn, and put in the hard work.
I actually had a mentor that once said something very important to me. I was young in my career and trying to figure some stuff out, and I felt embarrassed that I was asking a lot of questions. And he was like, "Look, it's the mark of a wise person is the person who asks questions," and
Yeah,
that this right
100%.
here is evidence of that, right?
100%. And you made me think of something else. I remember sitting at a conference, and it was related to pain. It was a pain summit down in DC, and they were discussing the eurekas that we've come across in treatment. And basically, what they said was, we don't come across eurekas in treatment because we're diligently seeking that answer, and we have that, and we have an idea what the solution is. Most eurekas come by, over time, observing and seeing that there is this one little point of information that is intriguing, and that
Mhm.
that ability to observe and patiently wait opens up the door to that eureka. And most of us, again, I guess if you come at the right time, like you just said,
Yeah.
um, you're lucky enough to see that eureka.
Yeah. Yeah. Persistence and working at things unlocks things. It reminds me, my dad bought me a book when I was a kid. And I can't remember all the products offhand, so don't quote me on this, but it was a book of accidents that turned into like massive companies and brands. And like a lot of ideas that just originally the original intent wasn't XYZ, but it certainly turned into something.
Absolutely. It's like the microwave, actually, right? The story of the guy that was working at I think it was a plant. I won't get into what kind of plant, but he liked chocolate, and he would carry a Hershey bar in his pocket. And he noticed that every time he walked past this one piece of machinery that had microwaves, that the chocolate would melt.
Yeah.
That observation led to the microwave.
Thank goodness, because there's been many times where I didn't plan my lunch appropriately or something, and I needed
Right?
that
I just need
innovation.
something fast.
Cool,
Please.
cool.
Yes. Thank you, Hershey. Thank you, guy that was like chocolate.
Love that. And so I wanted to dive in a little bit more about PainTrace, because like it's such a cool idea, and I want to help the audience understand how it works. So one question I have for you is, how does it work? What makes it unique compared to other pain management solutions that you see in the marketplace?
So PainTrace is unique. When we talk about pain, each one of us has a very individual experience of pain. Um, and so I think that's what initially seems very difficult to understand. Like, my pain is different than your pain, so how could we measure pain? And PainTrace with skin-based sensors actually is quantifying the activity of the brain. You can actually pick up on different parts of the brain that are processing the neurosignals that are coming from the body. So when, let's say you have knee pain, we'll call it that. You have knee pain, it sends a signal up to the spinal cord, and then the spinal cord or the central nervous system. From there, it's synapses, it sends a signal to the brain, and then the brain has this part called the thalamus, and that actually directs the signaling. And it says, hey, we need to figure out where this is and what this is. Let's send this a message over to the cortex. We need to figure out, how do I feel about this? Let's talk to this part of the brain. And we need to figure out, has this happened before? Let's loop in this part of the brain. Let's take all of this information and send it down to a central processing system, which is the amygdala. And then let's sort that out. How do I feel about where is it? What is it? How do I feel about this? Has this happened before? Is this something I'm worried about? Is this threat? Yes, this is threat. Let's send the signal back down. And PainTrace picks up on that central processing, which is what allows us to understand not only pain, physical pain, but also emotional pain.
Interesting.
We can tap into how you feel.
Interesting. That I love talking about this with you. That has so many implications, because it's not only like my elbow hurts, but like the other thing that's tied to injuries and trauma that have acute or chronic pain to follow up with that experience is anything like emotional, anything tied to that can be very interesting as we continue to learn more about mental health and incorporating that into care.
Suffering, right? It's suffering is the word that I see in some of the articles that I read, and functional magnetic resonance imaging has given us so much information to truly understand what is happening within the brain, and how, exactly like you just said, our cognitive health and our physical health intersect. And much of that, I mean, it's so fascinating, because you can take that and you can even delve even deeper into ACEs, right? Adverse childhood events. You can connect those to the neurocircuitry that you're forming throughout your entire life and all those experiences, because neuroplasticity is the whole concept that the nervous system can change over time.
Yeah.
And so it's literally a culmination of everything, everyone, all the experiences you've had. It's constantly learning and reframing. But early childhood or adverse childhood events are connected with chronic disease states. And pain is kind of at the center of that, because pain isn't necessarily what we consider just pain. It's stress, right? It's stress on the tissues, it's stress, emotional stress, and all of that is literally a big nerve loop. It's literally a feedback loop between the body and the brain.
There's so much data. There's so much, you're helping me imagine this network in my body that is fine-tuned and designated to help me understand, like, hey, something's going on, right? Take your hand off of the stove.
That's true. Yeah.
And
You're not right there.
yeah, that's quickly observable pain. I wonder how it connects to the patient experience and like taking all that information and putting it in the right position for clinicians and people providing care. Can you speak to how that works with PainTrace?
Yeah, so that's actually, it's funny. I did pull up some slides that I presented at a conference a couple months ago. And one of the things that I stumbled on, and I just want to look back because there's a number I'm looking for. So it was a study, it was a meta-analysis, and what it did is it looked at the impact of mistrust on the patient and healthcare provider relationship and the effective outcomes on mistrust that mistrust has. And it was kind of this kind of eureka, because when you think about it, if you have an objective piece of information that both the patient and the healthcare provider can work with together, that level of communication creates trust. And if you can develop trust and between the people that are working together, teamwork, and you can actually then work off of an objective measurement, you have the ability then to truly affect the outcomes. Because without trust, patients actually change their self-report of pain. So if we're depending on a patient's self-report of pain, but there's a lack of trust in a particular group of individuals, then what do we do with that? That affects the outcome, that affects the treatment. And so if we just have an objective measurement, I think that's kind of a step one. We've actually established a great communication tool.
I think that's abundantly important.
But then if we can do that, and you said this, so, and I may be extrapolating beyond your question a little bit, but you said this and I loved it. And I followed through with it because you and I've talked about this a little bit before.
Yeah.
KPIs, right? So we now establish this core piece of information that we're working with, which establishes trust and communication, right? And we also now understand what the delta should be, right? So we have an outcome measure. So we understand this individual, we're giving you this treatment, and we understand that this is an average outcome. So if we understand that's an average outcome and you have a better than average outcome, cool. Let's keep going.
Please, doc, please tell, am I doing better than you expected? That's
great.
When I'm scared and concerned.
High fives all around, man.
Yeah.
We can see that you're doing better. You say you think you're doing better. Maybe you don't think you're doing better, but the data says you're doing better. So that can also help in that process, right?
Absolutely.
Or you think you're doing better, but your doctor doesn't think you're doing better. But we look at the data and it tells us that we're doing better or worse, right? Mm-hmm. You think you're not doing as well. Your doctor still thinks you're doing fine. And you look at the delta and you realize that you're not, Now, if you have that, it starts to personalize the care, right? Everybody's working off the same piece of information. We have a KPI. We can understand, does this work for you or doesn't this work for you? And then what we can do from there is iterate.
Yes.
Better, 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 better.
Yes, it is always easier to talk about the objective, like quantifiable information, especially in scary conversations that could drive quite a bit of emotion. Um, my wife can testify to her pain threshold being very different than mine. I'm a big baby in comparison to her by by her marks. I would love this could solve some issues outside of
Yeah,
the
right. You guys
clinical.
could go to the test. We
Send
do
some
want to
couple
have pain
devices over
competitions,
to me.
yes.
But jokes aside, I think that's a remarkable moment. There are so many, audiences and demographics that complain about maybe not hearing, not being heard or being viewed in the way that they need to be viewed when they're in quite a bit of pain. Or, vice versa, to be fair to clinicians as well, as I've got to be careful. The path forward to treating pain, as we all know, has, many implications that are not so great. And so to be able to truthfully discuss this and point to real data and tell that longitudinal story with KPIs is so interesting.
Absolutely. And to your point, like, a lot of times I have people come to us and say, oh, so, you're going to be able to see if someone's drug seeking. And I'm like, that's really not the main point here at all. The main point is actually to be able to understand if the treatment is working or not, if there's a requirement for treatment, if a treatment is working, and to personalize that care. I was just over in England, and to your point about voices that are not heard or people that are in pain, but it's not actually clinically clinically observable.
Mhm.
Fibromyalgia, right? So I was over in England, I was at a conference, and when we're at a conference, we will demonstrate PainTrace to people. So we measure people's pain. And I literally had a man come over to me and he said, some people have been telling me about this, and I'm just wondering if you can help me. He said, I have fibromyalgia. He said, but the doctors say it's in my head. And I was like, okay, no stress here. I'm not panicking yet. But I said, of course. I said, let's do this. Let's just measure your pain. So we could see that based on the baseline, which is the chronic pain, we could see that he had a negative baseline. So we could tell he has chronic pain on just an everyday moment. It's kind of like stepping on a scale. And I said, okay, so you've got a negative baseline. So I can see that there's something going on with you. I said, but I don't know what it is. Is there something someplace where you feel pain, something that you could do that would show that? And he said, and he kind of went like this with his hands, he flexed his fingers. And I go, okay, well, we see that. And he was watching and he goes, oh, well, yeah, that is painful. And I was like, well, we see that there's the acute response right there. And I said, is there anything else? And he goes, well, sometimes, like my back, and he flexed at the waist and we could see some response there. And he said, but the other one is really here in the axilla, on my side here. And I go, okay. And he started to palpate, but we had the sensors in a place that they were going to be in the way. And I said, tell you what, I said, do you mind if I just touch you, in that area? And this was just completely we're at a conference. It's just a nice way to demonstrate what this does. And nothing clinical. And I touch him here in the axilla, and we see the acute response. And I said, he said, can I take a picture of this? Of course you can, but it was almost like it broke my heart a little bit, because he has pain. He's been told he doesn't have pain, and we were able to just show him,
Yeah.
at least give him the satisfaction that we see it too.
Yeah. At minimum, maybe the cause of that pain, he may not be correct. He may be correct, but at minimum, when you can see, again, objectively through observation, something is taking place. Well, how do we continue to have the conversation, which dovetails nicely into a question, given what this technology can do. if the point is to quantify pain, if the point is to find that observation that clearly states something is going on here, how might physicians, clinicians leverage this? I know we've talked about it a little bit earlier in the conversation, but let's use this as a thought exercise. What next?
Right. Yeah. We've had a lot of conversations with physicians and what their applications would be. One of the conversations that always comes to mind is in speaking with the person that has run the inpatient pain management program at Johns Hopkins. And what he said is one of the most difficult things is when you're looking to maybe ask a person to stop using opioids and move into other modalities of care, physical therapy, greater movement, maybe another pharmaceutical, and a combination of treatments. He said one of the most difficult parts is actually convincing somebody that they're getting better and that they don't need the opioids. And we talked about PainTrace as almost like stepping on a scale when you're losing weight, or having like jeans get bigger and bigger, and or if you think about it, when you lose weight, oftentimes like somebody you haven't seen for a while is like, oh my gosh, you look great. But you looking at yourself in the mirror every day don't see that change, not to the same degree.
Correct.
And so the ability to actually show somebody that there is objective improvement, pain mitigation, that this is working for you, is one of the feedbacks that we receive from practitioners, which I think is valuable. The other is surgeries. So I worked in orthopedics for a decade, right? So I know a lot of surgeons. We work with a lot of surgeons, and they, when you look at the data, surgically for joint replacements and back surgeries, about 20% of the patients still have pain. They still have bad outcomes, and the number one reason for a bad outcome is pain. That's the number one factor there.
Yeah.
Ultimately, the question is why, right? Like, why does somebody have pain? Even though the surgery could have been just like absolutely picture perfect. So the other fact there, when you look at the data, is that in surgical operations or surgeries, you'll find that 30% of people that come out of surgeries have immediate post-operative pain. And we also work with a fair amount of anesthesiologists, and an anesthesiologist will tell you that about 30% of blocks are insufficient or don't work. So if you're having surgery and we're cutting open your skin and we're removing things or putting things back together, you betcha that if that nerve block's not 100%, there's a signal going from that point of surgery up to your central nervous system, up to the brain, and that's called a nociceptive barrage. It's a mass amount of neural input. And that can actually cause the central nervous system to become maladaptive, meaning your central nervous system is going to create what's called centrally mediated nerve pain, potentially. So it's going to have this pain signal that is just existing in the brain, even though the body goes on and the surgical site heals, everything was picture perfect, it's all good. And of that, the 30% of people that wake up after surgery and have immediate post-op pain, 80% of those people go on to become chronic pain patients. So you asked, where does a clinician see that this is useful? To be able to look at an individual in advance of a surgery and be able to determine, do they have some form of anxiety or predeterminate that their central nervous system is going to be more wound up and their pain response is going to be heightened? We can manage that via anesthetic protocols with anesthesiologists. intraoperatively, what I just described, if a nerve block is not 100% and there is what's called a nociceptive barrage, we have the capacity to detect that while a patient is sedated or anesthetized and manage that and take down the number of people that are having postoperative pain and take down the number of people that become chronic pain patients. And so ultimately, and we can also follow them after the surgery and figure out like, hey, how you doing? Oh, wait, you're still painful. You shouldn't be. Why don't you come on back in here? Or you're still painful. Hey, physical therapy is going to really be a good thing for you.
Wow.
Or laser or whatever, multimodal care.
Yeah. Yeah, to jump on one of the important things I keep hearing at conferences and in these discussions, this is exactly what digital health should be involved in. This notion of being proactive and thinking ahead, like, what have we learned from the old way of doing things and how might we rethink the experience? Like, if I was choosing between one surgeon, Surgeon A and Surgeon B, and Surgeon B was speaking to me the way you just were speaking, where you're like, I know this is going to be painful, right? We're going to go and disturb your body for the better, but it's a major disturbance to do this procedure. And we're going to be thinking of what your pain state was before, after, and continue to track and preemptively, proactively go after ways to make this a better patient experience for you.
Absolutely.
Love the notion of that.
It's all about quality of life. And what if we could motivate, what if we can motivate you to go, it hurts to walk, but I can see because I'm monitoring my pain, every day I can walk 5 minutes longer. And you do that for 2 weeks and you find out by the end of that, you're capable of walking an hour longer than when you first started without pain. And the walking's good for you because movement is life and life is movement.
Yes. And thank you for calling out that point. That's so important. Like the measurement, the incremental improvement, especially when something that is so natural to us when we're healthy and just an assumed function. Like, I'm going to wake up tomorrow, I'm going to walk over to the coffee maker and make coffee. And and that's going to be my life. But when that's not there, when that's
Yeah,
no longer the case, it's not just an assumed portion of the quality of your life. Like, how can we communicate to patients? How can we communicate to doctors? Because it is a two-way street, as you mentioned before. Like, hey, like, this is what's going on, but here's the number that is that beacon of hope, or maybe a heads up that there's some areas we need to improve on as well.
absolutely. Right. And I think that's the interesting part about pain is because they're truly, because there truly is the cognitive side and also the physical side. And your motivation, right, plays a very large role in, and your cognition plays a very large role in your experience of pain, and also how you manage your lifestyle, which manages your quality of life and mitigates your pain. Um, and to your point, because I really do believe in digital health, I do believe that there are a lot of opportunities. I actually pulled some of these slides because from a previous talk, and I was like, the numbers are pretty telling. And this is part of what I think is really interesting about the notion of digital health and where we can go with this. So one of the studies I found showed that monitoring of heart failure patients reduced mortality and the days spent in hospital by 1/3.
Wow.
So digital health, right? This one was by adding an additional 1,000 steps per day. You could increase your lifespan between 6 and 30%, depending on how sedentary you were before, right?
Yeah.
This one, I was like, oh, because this is really where I think I would love to see all of this go. 80% of diabetes can be prevented by changes in how we lead our lives. $280 billion a year is spent nationally in the United States on those diabetes treatments. That's half the entire public schools budget in the US.
Had no clue.
What?
Yeah.
So the ultimate goal, is from our perspective is, okay, so we play this role in monitoring acute and chronic pain. We want to personalize medicine because we want to create, like we talked about, those KPIs that allow us to go, hey, this is working for you, this isn't working for you. Let's iterate faster and get you back to health. Let's make sure we have you not in pain and keep you out of pain, whether it's preventative or proactive. But if we can personalize care and we can actually personalize outcome measures, then that leads to value-based care, which makes sure that people are well, we're doing it efficiently, and we're saving a ton of money. And then if we're saving, in that example, 80% of diabetes can be prevented, and the cost of that is $280 billion a year, and that's half the entire public schools budget. What do we do with all that extra money?
So much
Save
space
the
for
planet,
innovation. Yeah.
educate people,
So much space for innovation
go
with
have a party.
that. Yeah.
Okay with that.
Yeah, no, that you make a very good point, and thank you for sharing that stat. I hadn't realized the comparable budgets between those two. I mean, very important things to address, but when you put it in that perspective, it's like, wait a minute, right? There's room for improvement, and so it's so fun and energizing to talk about innovation, but you and I both know it's not absent of challenges. So could you
Don't say
share?
that when I'm drinking my water.
Yeah,
I might
you're right.
choke.
I should have timed that better. It's not absent of it's not absent of challenges. Do you have any challenges that you face that you're willing to share with the audience, and just kind of talk about maybe some of the tougher parts of innovation in this space?
Yes. I would imagine that all founders have PTSD. No. Yes, there are certainly quite a few challenges. And I think the challenges are money, money, money. And does anyone care about your innovation? And quite frankly, focus. Focus is a really big one, right? So you've got a great innovation. And let's say you even got a patent or 2 or 3 or 4, we're there, we've got all that. But what do you focus on and how do you get there? What is your pathway? And then you think you've got a great pathway, and guess what? 1,000,001 things go wrong. And that goes back to the first part, money, money, money. Because when things go wrong and they take longer than what they were supposed to, you're going to need money, money, money to make sure that you can get to the final place. And I just had a conversation with another company, because this is the other really big part about the hurdles, but how do you overcome them? There are a lot of different skill sets that it takes to be able to achieve the ability for an innovation to become an actual revenue generating business. And the way that you get there is by partnering. You're not going to go there alone. That doesn't happen.
Right. Right.
You could get pretty far, but I don't think you're going to get there alone.
Yeah. Yeah. You're queuing yourself up to be introduced with someone I spoke to this morning that I think you two should meet. I won't go into too much detail here, so I'll keep it moving, but you're absolutely right. And that's one thing I love to do, is just try to foster collaboration wherever I see it, because like you said, there's you need to be focused on your thing, and you need to position your innovation to plug in with other innovations, because at the end of the day, especially with the mission and vision of making the quality of life better for patients and clinicians and all of us who inevitably will need care, is to create an environment where the best solutions are put forth and focused on what they're supposed to be focused on and integrated into other solutions.
100%. And I think that's where, Radian and the work that you do is super important. And a conversation that you and I have had around, like, the quality of the solution that we create is truly a partnership, and working, with a company like BioTraceIT and a company like Radian, putting together a thoughtful solution. Because one of the things we talked about was, what do you do with information, personal information that can be really sensitive to an individual, right? How do you deliver that information in a digital manner that is going to be valuable to them as an individual, as a person, right? And one of the things that I think both you and I agree on when we talk about, like, creating solutions for individuals is having this level of empathy and sensitivity about how we deliver that information. If we're going to interact with a person to create contextualization around data, like PainTrace, then how do we ask questions? How do we deliver information in a motivational way rather than a demotivating way?
Yeah.
Our goal is to get people to actually, get up and change their lives for the better.
Yeah. Yeah. And we've chatted about it before, and I also continue to think about family members that are getting older. Sometimes I look at how messages are sent to them, and how things are communicated, and it's like, boy, like that could have been done with a little bit more empathy. And you don't think of technology as a vehicle of empathy. And I'll refrain from telling the jokes about all the generative AI stuff where you see messages from the bots are more empathetic than human beings. We won't go deep into that, but like you pointed out, if thoughtfully created, there are some really important moments that can take place, or decisions to refrain from communicating something through a app notification and triggering an automation to make it a phone call or a request for an appointment or whatever's more human, right? Because at the end of the day, we want to put all this technology kind of in the background and take this very human experience that is your health, that is your journey towards healing, that is prevention of future ailment, and make it as human as possible, and uh and not feel like just an app that's cold and calculated. You know what I mean?
Absolutely. And I think that that is exactly it, right? And I was reading, just looking at different articles, because it's a combination. It's never ever going to be all the tech, right? It really won't be. It is this seamless combination of human interaction, technology, right? And how we apply that. And in conversations with individuals that are in the digital health space, one of the things that's really important for health and mental health, and I think also physical health, because of the interconnectivity of the two, is getting out and talking to people, right? Like, what if PainTrace not only measures pain, right, but it also measures, on the flip side of that, how unpainful you are. We'll call it that for now.
Yeah.
So that I have to be, and then I have to say potentially, right? Because, like, everything, has to go through its process. But on the flip side of that, like, how well are you, right? How optimal are you? How
Yes.
pain-free are you?
Mhm.
And what if we could actually show people having important interactions with other individuals, going out and hanging out with friends, getting back into life is important, and it makes you feel
Yes. Yes. Are you petitioning for a follow-up episode where we talk about the flip
better.
side?
Yeah, yeah. Well, the series is all okay. It's all good with me, because I always love talking to you, Max. Like, when you asked me to come on, I was like, yeah, this would be so much fun, because you and I always have the best conversations. Like,
Absolutely.
and I'm so thankful for that. Back to the how, life is a series of stumbles and random conversations, right?
Yes.
the whole reason why we are here today is because you and I sat down at a random table for breakfast at it was
Oh,
health at a health
yeah,
conference, and literally just started chatting.
right.
Had such a great time, bonded over music,
Yeah,
um, and some software that I had mentioned to my son Fenton, that
excellent.
you recommended. Yeah. And and here we are.
Yeah, yeah. And and that's why I'm so excited about continuing to have conversations like this. And again, I'm going to be following up with someone I talked to today that you should be talking to.
Okay.
So if you're listening to this podcast, that's a part of what's so important about what we want to be doing in the coming future here is just continually driving these conversations, thoughtful technology rooted in healthcare. And to that point, because that's often a forward-looking conversation, one question I have for you is when you look 5, 10 years out over the horizon, where do you see PainTrace?
Yeah. Um, well, it's interesting. I think it goes back to that focus thing, right? So our initial focus is quantifying pain, and doing that in a manner that starts out in a point of care setting, so we can create that bond and relationship, for a team effort around patient care, right? And drive personalized medicine and value-based care. But we know that we can do a lot more. Moving into the ability to become a factor in lifestyle choices, I think is something that we see coming. And then there's a whole bunch of other stuff that we can do that we don't talk about. And so, I mean, ultimately, when I don't like to think about the money part of it, but a friend of mine did put us into an AI perplexity app, and he was like, and it spit out the markets, and I was like, oh wow, okay, that's a lot, $80 billion annually, right? So if we ever, got into, and that was like, the obtainable, 10% or something like that. If
Yeah,
we ever got into a revenue like that, then I would like to see us be a benefit corporation and be
awesome.
able to
Yeah,
do very cool stuff,
yeah.
beyond, what a business does. Because I think that, if it ever really came to be what it is, which is we quantify pain, we have a really big opportunity to change healthcare, and then to start to take that opportunity to change a lot of other things, to look at children, um, and their well-being, and education, and how does all of that play a role? Because pain starts the minute that you enter this world, and the spectrum of that is all inspiring.
It impacts us all. And you're right, from start to finish, it's a major factor. I guess I have one last question, and it's just centered around how our listeners can learn more about PainTrace, get involved in supporting your mission.
The best place to go is just our website to start, paintrace.com. And we've been kicking around the idea of doing a Kickstarter. We'll see, or a crowdfunding situation, which would be, the ability for people to become a part of our mission, to change the face of how we look at pain, and impact people's lives. But our website, paintrace.com, is really the best place to go. And as new things arise, we'll just keep putting them, out there. And I also think that the next podcast that we do together will be another great place to come.
Yep.
So definitely Max and Radian is the way to go.
Appreciate it. Yeah, no, looking forward to continued conversations. I just want to express my gratitude for you, joining us and having this conversation. So insightful. Every time I learn something new and amazing from you. So appreciate your time, Deb.
Max, I absolutely 100% appreciate you all day long. I can't wait to learn more about Stoicism from you and continue those
Yes,
conversations as well. I know
yes.
you are a master, and I'm not worthy.
Yes, we definitely continue to connect about that.
For sure.
Looking forward
Thank you
to it.
so much.
Thank you for joining us on this episode of the Radian Podcast. If you found this episode insightful, we'd love for you to subscribe on your favorite podcast app or YouTube and follow us on LinkedIn or X for more updates and insights.